Deputy Prime Minister is with us, Mr Raab. Good morning. It's always
Good morning.
great to see you. Thanks for joining us. Let's start with the stats. Should we give us an update on the number of people who are in hospital with Omicron today?
I don't know the precise figures, but we do know that we've had the first deaths. There has been an increase, and above all, we're concerned about the rate of transmission. The positive side that we do believe, and again the information on Omicron is still sketchy, but that if people get their third jab, they're over 70% protected. And so we've currently got over 40% of adults with their booster, with their third jab. The big push is now by the end of the year to get people that booster. That is the surest way we protect ourselves while we find out a bit more about the real impact of Omicron.
You said deaths plural. How many?
I'm not sure of the
Prime Minister told us one yesterday.
That was my understanding. That's the latest figures. I know that there have been.
So it's not plural. It's one.
Again, all I can tell you is the latest that I've seen. In terms of plural, I was referring to. We now know we've got a significant number in hospital.
OK. How many are on ventilators?
I don't know the latest facts. I think.
And do we know if the person that died, did they die with Omicron or because of it?
I think it's often very difficult to say because a lot of people have combined conditions, if you like, particularly if they're old. So I don't know the full answers. And the truth is, Kay, just to be very honest, we don't know the full severity. What we do know is that the rate of transmission is so rapid that even if the severity is relatively low compared to other variants that we've seen, just because of the numbers, we need to take action now, which is why what the government is doing today, I believe, is a targeted, proportionate approach as we find out more.
We'll come on to that. I just wanted the data check to start with, which is very helpful for our viewers. You said a significant number in hospital. How many?
Well, the last I saw was in the low hundreds. I think 250 the last time I looked, but of course the data is being updated all the time.
250 out of 200,000 people who contracted it yesterday. That's still a very small number.
The problem is the rate at which it is transmitting. And if that continues, we'll see those numbers increase very dramatically. And then we know a proportion of those hospitalised will have possibly die or have a very serious suffering of the Omicron variant.
As a result of that, you want people to get jabbed as quickly as possible. How many people were jabbed yesterday?
I don't know yesterday, but I know we're up to 41% who have been triple jabbed. On Saturday, we got 500,000 get their booster. So that's why we want everyone by the end of this month, so by the end of the year, over 18 to be offered that chance to get a booster. And again, amidst the sketchiness of what we have deciphered about Omicron, we know that you're over 70% likely to be protected from it if you get that third booster, third jab.
So you want 1 million people a day to be jabbed, including on Christmas Day. 500,000 or so yesterday, I believe, if those are the figures that we're normally looking at. People waiting for 5 hours in the cold. What, are they going to wait 10 hours?
Well, no, look, I appreciate as we've ramped up this campaign and people have come forward, which is good. We want them to come forward. We know that there's been a challenge, particularly getting the online booking. It's the same for lateral flow tests. We're dealing with that. We're making sure that we've got the capacity, the walk-in centres. Bear in mind that at least up until Wednesday, this Wednesday, the offer had been to those 30-year-old or above. But from Wednesday, if you're 18-year-olds or 18-year-old or above, you can book online. The walk-in centres are there. We've deployed various teams of military personnel to really ramp this up. I appreciate that with all these things, as you introduce them at pace, there'll be some teething issues, but we are ramping this up at pace, and it's good news.
Yeah,
we don't want people
the thing is the British public are ready.
Absolutely.
And you weren't.
Well, look, this is a rapid reaction to a variant over which we are gleaning more information every day, but we are going to be ready. We've ramped up the plans, the military involved, the Jabs Army, the volunteers supporting the NHS staff, and we've got the centres and we're boosting the capacity to deal with the volume of people. But as I said, the shift is being from Wednesday, the ability to book if you're over 18, not just over 30.
Why did you not do that earlier?
That we're responding to this as swiftly as we can in real time. It's a challenging logistical operation, but we've got the capacity to do this. And as I said, we're straining every sinew from the military to the volunteers to the NHS staff to do this.
Given that, will everybody who wants one be able to get a jab by the 31st of December?
Well, look, everyone...
It's a yes or no question.
Well, it's not...
Well, it is. I mean, you're telling me how fabulous all this work is that the government's doing.
The offer will be there.
So everybody who wants a jab will be able to have one.
Look, we're doing everything to get as many people as we possibly can jabbed, and of course. We're starting from now, I think it's 41% who have had the booster. We've got that capacity, we're ramping it up, and we want to get as close to that as possible. But look, the offer is, the target is to get everyone over 18 offered that booster.
But no guarantee.
Look, we'll do everything we can. We're straining every sinew. You know, we've got that capacity up. The good news is we got 500,000 people per day getting that booster. And every time we hit that with a day, that's 500,000 people with 70% protection, 70% plus from Omicron. That's good news.
So one of the ways to get people through quicker is to get rid of the 15-minute observation time once you've had your booster. What are you going to do about that?
Well, I think if we did that, and you can always look at things like that, you'd get people concerned about any potential side effects, which are only for a small minority. I mean, I remember sitting there 15 minutes and being champing at the bit to get off. But I think the NHS do want to make sure we just look after and keep an eye on anyone that might have a side effect, even if it's a very small number of people.
So there's no guarantee, and I understand what you're saying, there's no guarantee 31st of December that everybody will have had the jab, even those who want it, even those that want to stand out in the cold. When then will we find ourselves in a position where fully vaxxed means 3 jabs?
Well, sorry, I'm not sure I quite understand.
So at the moment, you have to, in order to have a passport, you have to have 2 jabs. We're saying now that you have to have 3 jabs. At what stage?
Well, I think let's gauge how far we get. We want to make sure, of course, we've got everyone who wants to have that jab the opportunity. And so we haven't got a definitive timeline. And, of course...
I was reading this morning that it's February. Is that not right?
But I don't think a decision has been made. It's certainly not been set out. And, of course, it's not just...
Is that a reasonable time, February?
Well, look, obviously what we want to do is get as many people with the booster as possible, and that would make it, I think, easier to introduce that. But, of course, even if you haven't had the double jab or, in due course, the booster, you can still rely on the lateral flow test, which is why I think some of these concerns about this are overstated, in my view, because I think if you're going into a crowded place, I would personally want to, for my own safety, but also for those around, want to make sure that I either had a lateral flow test or I was double and, in due course, triple jabbed.
So I've on my travel passport at the moment, I have, because I've had the booster, it's got all 3 registered on there. That's not necessarily going to be the case. You won't necessarily need all 3 to show that you have been fully vaxxed.
Well, at the
going
moment,
forward. Yes or no?
At the moment, the rules are double jab.
I understand what the rules are now.
Or a lateral flow test.
Yeah.
And of course, it'll depend. If we look, ideally, we'd get everyone triple vaxxed, and that is the best way. Because, of course, the lateral flow tests are pretty reliable, but not 100% reliable. The best way is to get vaccinated, for sure.
How are you feeling about vaccine passports?
Look, I think it's a difficult thing to do. I do understand the concerns people have, but I think it's necessary. I think people want to see us grappling with the Omicron variant in a sensible, targeted, proportionate way. You talked about people feeling uneasy. I know in other interviews I've done, they said the same thing. I think we want to provide that reassurance, and I think this is a proportionate way of doing so. OK.
The reason I mention it is because Tory backbencher Marcus Fish, this is his quote. I don't know how my viewers will feel about it. I'm interested how you will. We live in a free society in this country where people have the freedom to do what they want with their own bodies and freedom of association. We are not a papers, please society. This is not Nazi Germany. It's the thin end of an authoritarian wedge. How do you feel about this government being compared to Nazi Germany?
I'm afraid I don't accept that. But I know Marcus very well, and I know he's got a strong passion and he feels very strongly about...
It's offensive.
Liberty. Look, if you want to invite me to criticise people
I want you to... my viewers this morning will say that is offensive,
well, I don't
especially those who are Jewish.
And look, I don't accept it, and I don't think it's right, and I don't think it's a reasonable critique. But I do understand the concerns that people have. But all I would say, as I said before, is, you know, either... you can demonstrate that you've been double jabbed, or that you've taken a lateral flow test. I don't think that is a particularly intrusive thing to do in order that we can all protect not just ourselves, but those around us in the limited number of crowded destinations or venues that this applies to. We're talking about, I think it's 500 indoor, over 500 people indoor, over 4,000 outdoors. I mean, this is just, I think, a sensible precautionary public health measure that will protect us all.
At least 79 of Marcus Fisher's colleagues agree with him, though perhaps not phrasing it quite the same, and they are going to vote against the government proposition today. How do you feel about Labour having to prop you up again?
Well, look, I don't think it's going to be the case that Labour have to prop us up, but the fact of the matter...
lose the vote otherwise.
Well, I'm not sure you're right. Well, I've done lots of these votes before, and you get these numbers banded around the media, and actually we have a debate, and one of the things you do in debate is you listen to the other side. I do think that's important, listen respectfully to the other side, and I hope the government will be listened to as well. We'll make our case, and I'll be very surprised if the number is as high as you described. But the bottom line is the business of government is doing what's right for the country, and that's what we'll do.
What if it is as high as that?
Look, you can ask, I don't know about hypothetical questions. The reality is the government must do what it sensibly believes is right in the interest of the country. I believe these are proportionate measures, coupled with the big surge in the effort to get people boosted before Christmas. I think that's the right approach.
Yeah, but given that, and if there is a rebellion, perhaps not as high as 80, perhaps 79, that will mean that you will have to look very closely at wider restrictions, and those are just not going to come down the pike, are they? Or are they?
I think we'll get these measures through. I think a large number.
You will, because Labour will support you.
Well, and I think the number one focus is on the booster campaign. Because it gives us you that extra efficacy against the Omicron variant. And of course, this is a temporary thing because we need to find out more. We've still got a relatively sketchy sense of how dangerous Omicron is. I understand those who say, well, there's no, we don't know the full impact. I understand that. But I think what we've got to do as government is to take a precautionary, balanced approach to stop the worst implications. And precisely because, in 3 weeks' time, I'd be on this show and you'd be saying to me, why didn't you act more swiftly? We are acting more swiftly, but we're doing so in a proportionate way.
Deputy Prime Minister, are we looking at any further restrictions?
We've got no plans, but the plan is for Plan B, coupled with the vaccine booster surge in making that available and helping people.
No further restrictions in the pipe. The
one thing we know about the pandemic.
Is there a Plan C?
No, there's a Plan B. Who knows whether there'll be another variant along the line. But we're learning more about the virus every day. We've got this Omicron variant, which has created a different set of challenges, but we're getting to grips with that. And we've got Plan B, and we think it's the right one.
So we won't be paying for a good Christmas then?
We won't be
paying for a good Christmas. You'll have a lovely Christmas, but you'll bring new rules in very early in the new year.
Look, I think people can go into this Christmas, enjoy it. We've got an opportunity to spend time with loved ones in a way that we didn't last year. And at the same time, I do think it's right to encourage people to get the booster vaccine.
Absolutely.
And we'll go...
No further restrictions are in the pipeline,
well, look,
is what I'm saying.
Look, we've got none planned.
Given this variant, as a result of this variant, there's no further restrictions in the pipeline?
The plans are the Plan B with the masks in the settings that I described. We're encouraging people to think about whether they need to go to work, if they can work from home, if they can, and it's the right thing to do. And yes, we've got to take these other measures in relation to particularly crowded places, indoor, outside. That, coupled with the vaccine booster campaign, is where all our focus is. OK,
I just want to ask you about the European Court of Rights before I let you go. Almost out of time. The bill that you're talking about doesn't actually affect citizens' rights to seek redress, does it, at the European Court of Human Rights? So what does it actually do, what you're suggesting?
We'll do three things. First of all, we've got a proud tradition of freedom in this country. We'll strengthen the quintessentially British rights like freedom of speech, the liberty that guards all of the others. We have seen that whittled away recently for various reasons. Secondly, we can prevent some of the abuses of human rights that people care about, the ability of people to scupper deportation orders who have been convicted of serious offences. And thirdly, one of the things I think people see is the goalposts shift on human rights and expand incrementally. That ought to be subject to democratic oversight by lawmakers like me, accountable to your viewers. And those are the three big things I think we can achieve, take forward our tradition of freedom in this country.
Any Christmas parties planned at Downing Street this year, do you know?
None that I'm invited to.
Doesn't mean there aren't any. Well, it's good to talk to you as always. Thank you very much indeed for joining us. Thank you.